We're working to connect a region of over 600 million bridges between our lands.
Hello, I'm Alma Angeles. We're moving to the next stage of this pandemic, and as the world resets to the new normal, we find ourselves seeking the right balance between health and livelihood, constantly adjusting the boundaries between liberty and responsibility. Welcome to ASEAN in Focus. First, we would like to welcome our very special guest on our program, Mr. Natapanu Nopakun, the Deputy Spokesperson of the Ministry of Foreign Affairs of Thailand. Good afternoon from Manila, sir.
Yes, good afternoon. It's a pleasure to be back on ASEAN in Focus.
Yes, and first I would like to ask, how are you, sir? How are you doing?
Yes, doing fine. Life is returning back to normal in Thailand, actually. Going back to work, going back to school, and everything else.
Mm-hmm. Thailand, first I'd like to ask about the tourism industry. Is it still closed for tourists until 2021?
Yes, well, the measures, we're in the sixth phase actually now in Thailand. So it's sort of like a phase of normalcy. However, we have not opened up yet for regular tourists, commercial tourists. We've allowed various groups of foreign nationals to return, those who are working here, studying here, and doing business here, but not yet tourists per se. So the commercial flights have not been, regular commercial flights have not been open yet.
Yes.
I don't know for sure yet when that will be open, but hopefully it will be a little bit before 2021. But right now we're promoting, of course, domestic tourism for those already in the country right now.
So there is potential for, so there is domestic tourism. What about domestic tourism stimulus packages? Do you have any?
Yes, of course. So the government has, in the past months, domestic tourism, not only for Thai people, but for foreign nationals who are already in Thailand to tour within the country, to explore within the country. And some of the various packages include, for example, vouchers for discounts for traveling within the country. So, for example, for hotels, there are schemes wherein people have to apply online for this sort of voucher, and they can save up in hotel costs as well as domestic flight tickets for around 40 to 60%. So they'll probably pay 40 to 60% of the regular cost, and even there is a sort of like a allowance for those who are traveling outside their home province to other provinces. An allowance meaning around 600 baht worth for food vouchers to spin up the local economy in the place that they're visiting within the country.
Yes, in my news lately, the United Nations World Tourism Organization, or the UNWTO, in May released multiple scenarios for the year, saying that international tourist arrivals may drop by between 58 to 78% by year end, depending on when governments reopen the borders. So, as you said, and that would translate to a loss of 850 million to 1.1 billion international tourists globally, putting between 100 million and 120 million jobs at risk. So, how is it in Thailand? How is the government coping with this?
Yes, so tourism, of course, as you all know, is a very big income earner for Thailand. Usually in normal times, we have around 39, we expect 38 or 39 million tourists per year. But for next year, we expect the Tourism Authority of Thailand governor actually informed me that we're expecting around maximum, maybe around 12 million next year out of the normal 39 next year because of the COVID crisis. But hopefully by a year or two, we hope for it to spring up to good numbers. But for 12 million out of 39 is less than half of what we usually have. The Tourism Authority of Thailand has been promoting actually sort of like a theme that soon one day we will be coming back to normal in terms of tourism. So one day hope to see you all again. In short, in terms of tourism, just be patient a little bit right now. All countries are affected by COVID. All of the tourist destinations that you see on screen now in Thailand and in ASEAN, in the Philippines, and other countries, I think it's a good time for the places to sort of like recuperate a bit in terms of environmental standards and everything. The nature, the trees, and everything. So when that is ready, I think we'll be ready for the tourists again. But from now on, of course, it's a new normal type of tourism as well, I think. So it will be less of a kind of like a mass jam-packed tourism that brings the pollution to the more environmentally sensitive kind, the more tourism that is kind of quality tourism, with quality distancing, quality for food, quality attractions, and things like that. It's a good time to bring back a new normal type of tourism. And the Tourism Authority of Thailand has been cognizant of this, has been recognizing this need. So hopefully, back to normal.
Yes, I miss visiting the Chatuchak market with the dried fruits and candies. But anyways, the travel bubbles or green lanes between countries as tourism solution for the time being. Is that being implemented also in Thailand?
Yes. So for the tourism bubble, actually here we call it a travel bubble because it's not only for tourism, it's for travel, and the focus is actually for businesses or business persons who need to come to continue their business in Thailand, but perhaps in a short-term stay, meaning they come and do business for 4 or 5 days and then return. So that scheme is actually supposed to be in parallel with the usual return of foreign expats. But the normal foreign expats would have to be under the 14-day quarantine that's compulsory. However, the travel bubble scheme would be for those who are coming in a shorter term, 4 or 5 days for businesses. That actually is still being under consideration. It has not been implemented yet. We delayed for a bit because of the consideration of the various the numbers, the situation, the fear. I think last month there were the news about the second wave in some countries in Asia. So that sort of like slowed down our consideration to open up the special arrangement. But soon that will be in place. It will actually be first for around 4 or 5 countries initially. First, business from Japan, from ROK, and some other countries, mostly in Asia, and it will be for travel bubble purposes, special arrangement. It's actually a bilateral discussion going on right now. So not yet implemented, but soon being discussed right now.
Yes, because hospitality sector is also shifting to wellness and health tourism in reaction to the post-COVID world. Regional domestic tourism shift, no, and shorter distances, limited movement for tourists. What about opening of schools, Mr. Natapanu? How are students, teachers, and parents coping? And what alternative education options are being undertaken? And are there any stimulus packages for teachers?
Yes, the schools, of course, was one sector that was affected very badly by COVID. I think around the world. So they have been faced with. The government has advised them to, of course, delay the opening of schools in the past month, the opening date of the classes, as well as to abide by the various social distancing measures. But recently, I mean, around like 2 days ago, just 2 days ago, the Minister of Education announced that schools can actually return back to their normal way of teaching now. No need for too much of online learning or too much of social distancing. That is because of the consideration domestically that Thailand has been faced with. So the numbers haven't been rising up domestically. No domestic infections at all in Thailand for around over 70 days already.
That's true.
The cases
Yes.
that we have are all imported
That's
from
true.
Thai or foreigners coming back to the country into quarantine. So with that consideration, the Ministry of Education announced for that scheme. So schools are now back to the normal practice of teaching, because we actually realize that, of course, online learning has its good points, but also it has its bad points for children of different ages. So if you're kind of like too young, it might be difficult to learn online, and for certain kind of courses. So we're back to normal, hoping that there won't be any effect or outbreak on starting the schools.
Have you heard any news about the Philippines over there regarding teachers returning from the Philippines? I don't know if you want to answer this, or you want to give your take on this. Did you hear any news about the Philippines? Yes, go ahead.
Well, first of all, in ASEAN, in the ASEAN member countries, of course, some countries have been able to control it to some point, and then still there's a second surprise wave, a second infection wave discovered. So it remains a very volatile, risky situation for all countries in ASEAN. So even though Thailand has no domestic infections, other countries might have higher numbers. We hope for the best. The Philippines, of course, still is still in that challenge. However, of course, in Thailand, we employ a large number of foreign teachers from many countries in our school, particularly for English language curriculum, for English language classes. And in that group, of course, includes Filipino teachers.
Yes.
So yes, we're aware of that. Many of the Filipino teachers have already been included in the group that have returned to Thailand in terms of the foreign nationals. So I think in total of around 4,000 or 5,000 foreign nationals have returned to Thailand in the scheme for work permit holders, foreign students, and the like. And Filipino teachers were included in that group already. One change is that the foreign teachers in Thailand, before returning, they have to submit, the schools have to submit their names to the Ministry of Education before coming to the foreign ministry, and before the embassies can process the certificate of entry for foreign teachers. So there's one additional step, because they are registered with the Ministry of Education. 2 days ago, I believe, there was an incoming flight, I think a special charter flight of Filipino teachers, other nationality as well coming in. So that's good news. Those are probably the teachers who have already sent their names with the Education Ministry, and the Foreign Ministry was aware. So they have been able to been permitted to return. But their flight, of course, is a different kind of flight, a chartered flight. So I think no matter what the situation in other countries are, how high the numbers are, how low, I think it remains important that we continue to return to normal in terms of life, in terms of education. Our schools appreciate very much, of course, having foreign teachers who are able to teach Thai children English or other subjects. So it's very important for that manpower, for that group to return to Thailand, so including Filipino teachers.
Yes. Okay. Do you have any last message for our viewers watching you right now?
For Thailand, we're in the sixth phase, which is the phase of normalcy. However, we are still kind of very, we don't want to be complacent, because many examples have shown us in countries like, I think, Vietnam or China, that even though the numbers have been low for a long while, there suddenly comes a new outbreak, or no domestic infection for over 100 days, like New Zealand, and still after 100 days or 90 days, there was still an outbreak that came, that was found. So our guard remains high. I think there's no such thing as too much caution, no such thing as too much preparation. So some people might say that it's kind of we're overdoing it, so to speak. But The results have shown that remain one of the top countries that have been able to fend off COVID.
True.
At the same time, in parallel, our foreign friends, foreign nationals returning to work, to teach, to study and do business in the various schemes remains very important. So our guard remains up, and we hope for the best for other countries in ASEAN as well in this fight. Hope that by this calendar year, I really hope that everything will be done and will be safe by the end of this calendar year for the countries in the ASEAN region. And next year we'll start all over.
So
in a good way.
True. Filipinos everywhere likewise wish all members of the ASEAN all the best in coping with this current pandemic. And congratulations to Thailand for all your recent successes in this pandemic. Thank you so much for your time, Mr. Natapano Nopakun, Deputy Spokesperson, Ministry of Foreign Affairs of Thailand. Thank you for your time. It's been a pleasure.
Thank you very much. Salamat po and more power.
Salamat po. All right, next to New Zealand now, where it has put its largest city, Auckland, back into lockdown after 4 new COVID cases were detected. Now that ended a 102-day streak without a local infection. LV Vivas joins us live from New Zealand. Hello, LV.
Hi, good evening.
Good evening,
good evening,
LV.
Awa. And good evening, good morning, good afternoon to all our viewers.
Yes. So, after 102 days, New Zealand detected 4 new cases of COVID-19 infections.
That's right, Alma. Last night at the press conference, Prime Minister Jacinda Ardern announced that New Zealand have 4 COVID-19 community transmission cases in Auckland. They are the first cases in the community for more than 100 days, 102 to be exact. In an attempt to go hard and go early and stop the virus from spreading, the New Zealand cases prompted the New Zealand government to activate the resurgence plan and had imposed alert level 3 for 3 days for the Auckland region only, which started to kick in at 12 noon today, 12th of August 2020. Auckland City is a city of around 1.6 million people. And for the rest of New Zealand, alert level 2 restriction was imposed. All restrictions will last until at least midnight on February 14, on Friday, 14th of August 2020, to give time to trace the source of the new cases. What does it mean? It means that in alert level 3 in Auckland, people should continue to stay in their household bubbles whenever they are not at work or school except for essential travels. Prime Minister is encouraging the work from home arrangement between employers and their employees. If people are currently in Auckland and do not live in Auckland, it was suggested that people should go home as soon as they can. In alert level 3, people should stay within their household bubble, but can expand this to connect with close family or bring in caregivers or support isolated people. They should not invite or allow social visitors such as friends to enter their home. It is recommended that they keep their bubble small. And when it comes to businesses, essential services including healthcare, justice services, and businesses providing necessities are able to open provided they have safety measures in place. They should not physically interact with customers, therefore no face-to-face transactions. Bars and restaurants should close, but takeaways are allowed limited to contactless transactions such as ordering by online, delivering orders via courier. In terms of wedding, funeral services, attendees are limited up to 10 people, and physical distancing and public health measures should be maintained. When you are out and about, you have to maintain physical distancing of 2 meters outside your home, including on public transport. It is highly recommended that people should wear masks if they are out and about. Public transport can continue to operate with strict health and safety requirements and should maintain physical distancing and wearing masks. Public venues should close. This includes libraries, museums, cinemas, food courts, gyms, pools, playgrounds, and market. And for people at high risk of severe illness, such as the older people and those with existing medical conditions, are encouraged to stay home where possible and take additional precautions when leaving home. And for the rest of the country who are on alert level 2 restriction, they should wear masks if they can in public. No more than 100 people at gatherings, including weddings, birthdays, and funerals. Businesses can open to the public if they are following public health guidance, which include physical distancing and record keeping. People at higher risk of severe illness from COVID-19, for example, those with underlying medical conditions, and old people are encouraged to take additional precautions when leaving home. Practice good hygiene. Stay home if sick. Team of 5 million have done an outstanding job of keeping themselves safe over the past 7 months. There is nothing more important than continuing to follow the alert level guidelines. Practice good hygiene and be conscious of their health, including staying home if they are sick. Keeping track of their movements as fast and effective contact tracing is very important. Wash their hands, cough or sneeze into their elbow, and regularly clean surfaces. This is the latest about COVID-19 situation here in New Zealand. Alma?
Thank you very much, LV, for your updates there in New Zealand. Thank you, EBC New Zealand Bureau.
Reporting live from Silverdale, Auckland region, this is LV Vivas of EBC New Zealand Bureau. We live in interesting times.
Thank you. Now we go from New Zealand, let's go over to Vietnam, where Eliana Faith Sebastian gives us an update on the latest situation there. Hello, Eliana.
Hi, Alma.
Good afternoon.
Here are the latest.
Yes.
Good afternoon.
Good afternoon.
Here are the latest updates here in Vietnam. First, Da Nang extends its social distancing measures. Da Nang will extend social distancing measures from Wednesday, August 12, after the first 2-week period ended on August 11. The city said the extension is to stop the spread of the virus. It said 277 people were infected with SARS-CoV-2 during the first isolation order between July 25 and August 11. 12 patients had died and 4 others were released from hospital, while 257 patients are in treatment at hospitals and field hospitals in the city. The city warned that local people should stay at home. All households in the city were allowed to go shopping at the market every 3 days to avoid overcrowding. Body temperature checks, health declarations, and testing will be conducted at high-risk areas where COVID-19 patients live or have been. Authorities locked down 2 residential areas in Tampi City in central Quang Nam province after 2 COVID-19 patients were found in the area. More than 200 people living in the area will also be tested. 6 COVID-19 patients in Quang Ngai province tested negative for SARS-CoV-2, according to the Pasteur Institute in Nha Trang on August 10. 2 patients, who are numbered 370 and 419, tested negative for SARS-CoV-2 3 times in a row, and they will be released from hospital soon. The 4 other patients tested negative for the first time, and they need at least 2 more tests to confirm they are fully recovered. Another COVID-19 update: 3 Japan returnees were diagnosed with COVID-19. 3 Vietnamese nationals repatriated from Japan were diagnosed with COVID-19 on Wednesday, taking the number of active cases to 451. The 2 men and a woman aged 33 to 36 returned on a special flight that arrived at Van Don International Airport in the northern province of Quang Ninh on Monday. All 136 passengers were immediately quarantined for 14 days in nearby Hai Phong City. With the trio, Vietnam has had 866 cases, of whom 399 have recovered and 17 have died. Of the total number, 321 have been imported cases that were isolated on entry. Another update: Vietnam approves $905 million expressway linking 2 border provinces. Prime Minister Nguyen Xuan Phuc has approved a 20.9 trillion Vietnam Dong expressway connecting Lang Son and Cao Bang provinces bordering China. The 115-kilometer long expressway running from an intersection of Tan Tan border gate in Van Lang district of Lang Son province and ending at an intersection of Chalin border economic zone in Kaobang province will be implemented as a public-private partnership project. It has four 17-meter wide lanes and will allow vehicles to ply at 80 kilometers per hour. The expressway will be constructed in two phases. The 2020 to 2024 first phase will see the construction of a 93-kilometer stretch from the Tam Tan border gate to Quang Ha district in Cao Bang at a cost of 12.5 trillion Vietnam dong. The remaining 22 kilometers connected to Trelin border gate in Cao Bang will be built after 2025. Currently, it takes cars 5 to 6 hours to cover the 280 kilometers from Hanoi to Cao Bang. The new expressway, along with the Hungi Chilang Expressway that is still under construction, will cut travel time from Hanoi to the border province of Cao Bang by half to 2 to 2.5 hours and boost the trade between Vietnam and China. Back to you, Alma.
All right, thank you very much, Eliana, for all your updates there in Vietnam. Stay safe, stay healthy.
Stay safe too. Reporting live from Da Nang, Vietnam. This is Eliana Faith Sebastian. We live in interesting times.
All right, from Da Nang, Vietnam, let's now go to Thailand, where Gretchen Kusadsad joins us live. Hello, Gretchen.
Hi, Alma. Good afternoon.
Good afternoon. Go ahead.
Okay, we have here new immigration documentation. Since the inception of the shutdown and the promulgation of new immigration protocols, there have been additional documents required by the Ministry of Foreign Affairs or the Civil Aviation Authority of Thailand, or CAAT, the Royal Thai Immigration Police Bureau, and the various embassies and consulates abroad. The three new broadly relevant documents required for all prospective entrants are: first, the Certificate of Entry, which is issued at the behest of the Thai Ministry of Foreign Affairs, which adjudicates the application for a Thai visa and also a sort of secondary visa. The second is the Fit to Fly certificate, required by CAAT, obliging the potential traveler to submit to a health check to ensure they are not infected with COVID-19 within 72 hours of travel to Thailand. And the third is insurance documentation showing coverage of 100,000 or more for COVID-related health issues. These documents are required in addition to a valid Thai visa issuance, of which may be dependent upon the new requirements relating to the rules of the specific consulate or embassy concerned. Upon arrival in Thailand, travelers will be required to undergo quarantine. Depending upon circumstances, and proof of quarantine arrangements may be necessary before departing for Thailand. The aforementioned documents are required before a traveler will even be allowed to board the flight to Thailand. As of now, Alma tourist visas are not yet being issued. Visa on arrival and waiver schemes pertain to nationals of certain countries, and a waiver of the need for a Thai visa has been suspended. Those who hold permanent visa permanent residence in Thailand, elite visa holders, and those already in possession of a valid work permit and business visa will be allowed to return to Thailand, subject to the newly required additional documentation, as mentioned earlier. However, those who do not have a business visa and/or work permit will need to apply for pre-authorization as a prerequisite for the visa issuance. While Thai O visas can be issued to parents, spouses, and children of Thai nationals, applicants for education visa must submit documentation proving that they are enrolling in a course of study and that the course is occurring at an accredited institution in Thailand. Those also wishing to obtain a medical visa for Thailand must first liaise with their medical facility to procure documentation related to the diagnosis of the patient and course of treatment in Thailand. This documentation will be submitted to the relevant embassy or consulate for review along with an adjudication regarding issuance of a certificate of entry. Applications also for work permits may be dependent upon the prevailing circumstances, while retirement visas are not included on any list for those being permitted to enter to Thailand. Moreover, Alma, those who are currently in Thailand, it is important to note that at the present time, the practice of border running and or visa running is not feasible as borders are closed. Alma, it appears that all visa categories require the newly created travel documentation such as certificate of entry, fit to fly, and insurance documentation. Back to you, Alma.
All right. Thank you for all that information, Gretchen. Stay safe, stay healthy. Thank you for your time.
Reporting from back. We live in interesting times.
Thank you, Gretchen. Now, Cambodia imposed a temporary suspension of flights from the Philippines, effective from Thursday. To tell us more about this is Meldy Mahinay, joining us live from Cambodia. Hello, Meldy.
Hello, Alma.
Hi, good afternoon. Yes, go ahead.
Good afternoon, Alma. Okay,
ahead.
here's the latest update, Alma. The government advised by the Ministry of Health has issued a statement announcing the temporary suspension of flights from the Philippines effective from Thursday. The move comes as 13 Chinese nationals flew back from the Philippines on August 9, testing positive the following day for COVID-19 while in quarantine. After the flight bans from Malaysia and Indonesia were enacted due to imported cases from the countries, hitting the double digits on July 25. The statement said it will now ban flights from the Philippines. The health ministry said the 13 Chinese nationals aged between 20 and 35 are now receiving medical treatment at the Chak Angrekrom Health Center in the capital. The 119 passengers who were on board the same flight as the group are being closely monitored, and they continue their mandatory 14-day quarantine at designated hotels, it said. A 13-year-old Cambodian girl and a 48-year-old Cambodian woman also tested positive for the virus on Monday, after arriving in Phnom Penh from United States via Taiwan on August 9. They are now receiving medical treatment at the Chak Angrekrom Health Center. The 75 passengers who on board at the same flight are being closely monitored as they continue their mandatory 14-day quarantine. Of them, 3 have been sequestered in designated hotels, while 7 remain in the capital's Pochentong Airport Center, the statement said. It said a 25-year-old Cambodian man was discharged from the hospital yesterday after testing negative for the virus twice. Cambodia so far has registered a total of 266 COVID-19 cases. Of them, 220 have recovered. Meanwhile, Tubong Common Provincial Health Official claims that a 29-year-old Cambodian man who returned from Saudi Arabia was readmitted for COVID-19 after being allowed to leave the hospital for 2 weeks. Tubong Common Provincial Health Department Director Dr. Keo Banak yesterday said the man was admitted to Ponhea Creek District Referral Hospital after testing positive for the coronavirus on August 9. He was released from the Chak Angre Hospital on July 26. However, due to the follow-up by the medical team who re-examined all patients who were treated after 13 days of their release, he retested positive and has gone back into quarantine, he said. Doctors will call to review the sample and we will retest him for the virus, Dr. Banak said. He said that 9 people who were in direct contact with the man were placed in the quarantine at Samdek Tekno Hung Sen High School in Seong City, and another 38 people who were indirectly in contact were quarantined in the school in Tubong Common District. This is the second case where a person who recovered from the virus relapsed, with a man from Phnom Penh readmitted in April 15 days after being allowed to leave the hospital. Back to you, Alma.
All right, thank you very much, Meldy, for your updates there in Cambodia. Stay safe, stay healthy.
Same to you, Alma. Stay safe and healthy. This is Meldy Mahinay reporting live from Chom Chau, Cambodia. We live in interesting times.
All right, we'll take a short break. ASEAN in Focus, we'll be right back. Okay, let's now go to Malaysia, where the prosecution is appealing to increase the former Prime Minister Najib Razak's jail sentence. Plus the COVID situation update there. Joining us live is Gail Aldos. Hello, Gail.
Hello, Alma. Good afternoon.
Good afternoon. Go ahead.
Here is the latest news. The prosecution has filed an appeal to increase the sentence of 12 years jail and the 210 million ringgit fine imposed on former Prime Minister Datuk Seri Najib Tun Razak for misappropriation of 42 million ringgit of SRC Sendirian Berhad funds. The Attorney General's Chambers Appeal Unit Head Datuk Muhammad Dusuki Mokhtar, when contacted, confirmed that a notice of appeal was filed last Friday, August 7th, through e-filing. He said the prosecution filed the notice of appeal against the whole sentence and fine imposed by the High Court. Muhammad Dusuki also said yesterday, August 11th, is the last day for the prosecution and defense to file their appeals, as both parties have 14 days to file their appeals after the decision on July 28th. On July 30th, Najib filed the notice of appeal against the conviction and sentence meted out by High Court Judge Muhammad Nazlan Muhammad Ghazali after finding him guilty on 7 charges of criminal breach of trust, money laundering, and abuse of position involving 42 million ringgit of SRC funds. The Pekan Minister of Parliament was sentenced to 10 years jail on each of the 3 cases of criminal breach of trust and each of the 3 cases on money laundering, and 12 years jail, and fined 210 million ringgit. In default, 5 years jail in the case of abuse of position. However, Najib will only serve 12 years jail, as the judge ordered all the jail sentences to run concurrently. Najib is currently out on 2 million ringgit bail in 2 sureties pending appeal. On to another news regarding the COVID-19, Alma. Malaysia's number of new COVID-19 positive cases returned to single digit, with 9 new cases reported yesterday, involving 5 imported cases and 4 local transmissions. Health Director General Dr. Nur Hisham Abdullah said this brings the cumulative figure of positive cases to 9,103 and the number of active cases with infectivity to 169. He said yesterday, of the 9 new cases reported, 5 were imported cases which were contracted overseas, involving 3 Malaysians and 2 non-citizens. The 5 imported cases are from Japan, India, Pakistan, New Zealand, and Singapore. Dr. Nur Hisham said all 4 local transmission cases involved non-citizens, 3 of whom were detected from the Bukit Jalil Immigration Detention Depot screening and have been deported, while 1 case was a referral screening case at the Queen Elizabeth Hospital in Sabah. He said 2 positive cases of COVID-19 are being treated at the intensive care unit and none required ventilator support. Furthermore, no increase in COVID-19 related deaths were reported, keeping the death toll at 125. Dr. Nur Hisham also said 6 more patients had recovered, bringing the cumulative number of recoveries to 8,809, 96.7% of the total number of cases. Meanwhile, he said no new cases were linked to the Sivaganga patient under investigation cluster and Kuro cluster reported yesterday. As such, he said the number of positive cases from the clusters remain unchanged at 45 and 5 cases respectively. Dr. Nur Hisham said 5,645 individuals from the Sivaganga PUI cluster and 180 from the Kuro cluster were screened. Active case detection and close contact tracing activities involving the 2 clusters would continue to be conducted. Back to you, Alma.
All right, thank you very much, Gail, for your updates there. Congratulations, single digits, back to single digits for Malaysia. Thank you for your updates.
Thank you, Alma. Reporting live from Kuala Lumpur, Malaysia, this is Gail Aldous. We live in interesting times.
To Pattaya now, where the province will establish the first hemp learning center. But let me emphasize that this is for medical research there in Thailand. Joining us live and to give us that update is Esther Odanga. Hello, Esther.
Hello, good afternoon, Alma, and to our viewers all around the world. So here's the latest update over here in Pattaya, Thailand. According to the Pattaya News, the Director General of the Department of Thai Traditional and Alternative Medicine, Marut Jirat Setsiri, along with Kampon Tan Sacha, President of Nongnuch Tropical Garden, and Rawat Arirob, Assistant Secretary to the Deputy Minister of Public Health, have signed a memorandum of cooperation for the research and development of cannabis for the medical use at Nongnuch Tropical Garden, Pattaya last Saturday, August 8. The project, which was established under the collaboration of Nongnuch Tropical Gardens and the Department of Thai Traditional and Complementary Medicine, aims to study and develop the use of these plant strains for medical purposes and allows all medical experts, citizens, and tourists to visit and study the plants. Nongnuch Garden President Kampon Tan Sacha told the Associated Press that various types of domestic and foreign hemp would be planted and experimented with as raw material to produce Thai traditional medical recipes. The president of Nongnuch Garden said to the press that the garden will be a research center for this project. It is going to be a learning center to produce an effective traditional medical recipe, which can be considered as the successful accomplishment of all Thai people. People who are interested in the project and curious about hemps are also welcome to visit Nongnuch Gardens and study the safe use of medical cannabis under the Thai current law, Kampon added. Also, Alma, Thailand is the first Southeast Asian country that legalized medical cannabis with the publication of the Royal Decree in Royal Gazette on February 18, 2019. The so-called Narcotics Act of 2019 is a modification of the Narcotics Act of 1979, whereby cannabis was still classified as a Class 5 narcotic, which changed in the process. While the recreational use of the substance remains illegal, Thai citizens are now allowed to apply for cannabis treatment following the new legislation. Moreover, research, cultivation, and processing, import, and export are now permitted for medical use. Back to you, Alma.
All right, so we just want to emphasize that this is for medical use. Recreational is still illegal. All right, thank you very much, Esther, for your updates there in Pattaya, Thailand. Thank you.
Reporting live from Pattaya, Thailand, this is Esther Odanga. We live in interesting times.
Okay, let's go now to Sri Lanka, where Vanessa Viloria Silva joins us live. What are your updates for us? Vanessa, hello.
Hi, Alma. Good afternoon.
Good afternoon. Go ahead.
Yes, Alma. Here's the latest update here in Sri Lanka. All prisons across the country, which were closed for visitors, would be reopened from August 15 with strict health guidelines, the prison spokesman said. He said that an inmate would be allowed only one visit per week, and visitors will not be allowed to bring foods for inmates, but they can bring clothes or sanitary items. All prisons across the country were closed for visitors on July 8, following the detection of a COVID-19 inmate at the Welikada prison. And for COVID-19 update, Alma, 5 new cases of COVID-19 have been identified, hiking the number of virus-positive cases in the country to 2,880. The new cases have been identified as recent arrivals from Indonesia, Saudi Arabia, and United Arab Emirates. In the meantime, the number of recoveries from the disease has moved up to 2,622, with 29 patients being discharged after recovery. 247 active cases are currently under medical care at hospitals. Sri Lanka has far witnessed 11 deaths due to the virus outbreak. Back to you, Alma.
All right. Thank you very much, Vanessa, for your updates there in Sri Lanka. Thank you.
Thank you so much. Thank you so much, Alma. Reporting live from Sri Lanka, this is Vanessa Viloria Silva, and we live in interesting times.
Thanks, Vanessa. Let's go back to Vietnam, where Chriselle Yacuna joins us live and give us, what are your updates for us, Chriselle? Hello.
Hello, Alma. Good afternoon to you.
Good afternoon. Go ahead, Chriselle.
Multi-layered demanded as Vietnam enters third phase of COVID-19 fight. Deputy Prime Minister Vu Duc Dam has tasked border provinces to coordinate closely with the border guard force in ensuring multi-layered control of entry and exit to prevent COVID-19 importation. Dam, who is head of National Steering Committee for COVID-19 Prevention and Control, stressed the point during his visit to the Vietnam border guard on Tuesday. All foreign experts and skilled workers who are allowed to enter the country must be quarantined in accordance with the current regulations on COVID-19 prevention. Dam reiterated. He tasked the Ministry of Public Security to direct local police forces to intensify inspection in order to timely detect and fine those who bring foreigners into Vietnam illegally. Dam took the occasion to appreciate the great efforts by all the border guard and police forces, as they have always been the frontliners in fighting the pandemic over the past 8 months. Vietnam entered the third phase of COVID-19 fight since the first community-transmitted case was confirmed in Da Nang on July 25. Over the last 18 days, the country confirmed over 400 community infection cases, including 17 deaths. In pursuing the dual goal of COVID-19 containment and economic recovery, the government has allowed foreign experts, investors, and skilled workers to enter the country, but borders still remain closed to foreign tourists. And for the weather update, heavy downpours are forecasted to batter both northern and southern Vietnam on Wednesday evening, according to the National Center for Hydrometeorological Forecasting. In southern localities and central highlands, torrential rain accompanied by thunderstorms and strong gusts will occur in the late afternoon and evening due to the southwest monsoon. The monsoon will generate winds up to 20 kilometers per hour. Average temperatures in southern Vietnam, including Ho Chi Minh City, will stay between 23 to 33 degrees Celsius on Wednesday. Meanwhile, in Hanoi, it will remain sunny during the day and rainy in the evening, with average temperature ranging from 24 to 30 degrees Celsius. So far, these are the updates from Vietnam, Alma.
Chriselle, for your updates there in Vietnam. Thank you very much. Stay safe, stay healthy.
Thank you so much, Alma.
Yes.
Reporting live from Ho Chi Minh City, this is Chriselle Yacuna. We live in interesting times.
Thank you, Chriselle. All right, and here are the coronavirus updates numbers in ASEAN. Take a look. In Brunei, we have one new case recorded on August 7, still taking the total to 142, 3 deaths. In Cambodia, the country recorded 15 new cases on August 11, bringing the total to 266, still 0 deaths. Indonesia saw 1,693 new cases and 59 deaths on August 11, taking the totals to 128,776 and deaths to 5,824. Laos, the country saw 1 new case on July 24. Still, the total is 20. Malaysia, the country saw 9 new cases on August 11, bringing the total to 9,103. It has 125 deaths. Myanmar has confirmed 360 cases. That's still on August 9. 0 deaths. And Philippines saw 2,987 new cases and 19 deaths on August 11, taking the totals to 139,538. Deaths is 2,312. In Singapore, meanwhile, the country saw 61 new cases on August 11, bringing the total to 55,353. It still has 27 deaths. And Thailand saw no new cases on August 11, and it still stands at 3,351. It has 58 deaths. And as of August 11, Vietnam's Ministry of Health confirmed a total of 847 cases of COVID-19. However, 399 of the affected patients have recovered and been discharged from hospitals. Vietnam has also recorded 15 deaths due to the pandemic. Now, the latest local cases have been reported from Da Nang and Quang Nam. And the global confirmed cases is 20,223,306. Global deaths is 740,276, and that is according to the Johns Hopkins University tally. That is the latest news in the Southeast Asian nations. Stay updated about the ASEAN region. I'm Alma Angeles. We live in interesting times.
Hello, my name is Robin, and I'm 5 years old. My mom and dad said many people are getting sick. That is why we have to stay at home. That is why I cannot go to school. I cannot play outside